Welcome to Rare's Health, your ultimate health and wellness guide. Subscribe for easy-to-follow health guides, motivation, and expert insights to transform your health. Do you often experience nasal congestion, facial pain, or headaches that won't go away? You might be suffering from sinusitis, a common condition that affects millions of people worldwide. Sinusitis occurs when the sinuses become inflamed or infected, leading to discomfort, breathing difficulties, and even long-term complications if left untreated. In today's video, we'll break down what sinusitis is, its causes, risk factors, symptoms, and most importantly, how to prevent and treat it. 1. What is sinusitis? Sinusitis, also known as a sinus infection, is an inflammation or swelling of the tissues lining the sinuses. The sinuses are air-filled cavities located behind the forehead, nose, cheekbones, and between the eyes. When they become blocked or filled with fluid, it creates the perfect environment for bacteria, viruses, or fungi to grow, leading to an infection. There are two main types of sinusitis. Acute sinusitis lasts less than 4 weeks and is usually caused by a viral or bacterial infection. Chronic sinusitis lasts more than 12 weeks, even with treatment, and is often linked to allergies, nasal polyps, or structural issues. 2. Causes of sinusitis. Sinusitis can be triggered by several factors. Here are the most common causes: viral infections, colds and flu. The most common cause of sinusitis is a viral infection, such as the common cold or flu. When a virus enters the nasal passages, it can lead to inflammation and mucus buildup, blocking the sinuses. Bacterial infections. If a sinus infection lasts longer than 10 days or worsens after initial improvement, it may be due to a bacterial infection. Bacteria thrive in blocked sinuses, causing prolonged inflammation and discomfort. Allergies, hay fever and dust sensitivity. Allergic reactions to pollen, dust, pet dander, or mold can trigger sinus inflammation, leading to sinusitis. Allergic rhinitis, hay fever, is a common trigger for chronic sinus issues. Nasal polyps or deviated septum. Some people have structural problems in their nasal passages, such as nasal polyps, non-cancerous growths, or a deviated septum, misalignment of the nasal wall, which can block the sinuses and lead to chronic infections. Environmental irritants, smoke and pollution. Exposure to cigarette smoke, air pollution, strong chemicals, and perfumes can irritate the nasal passages, increasing the risk of sinusitis. Fungal infections, rare but serious. In rare cases, fungal infections can cause chronic sinusitis, especially in people with weakened immune systems. 3. Risk factors for sinusitis. While anyone can develop sinusitis, some people are more at risk due to their health conditions or lifestyle habits. People with frequent colds or flu, recurring infections increase sinus inflammation. Allergy sufferers, seasonal allergies can lead to chronic sinus issues. Smokers, cigarette smoke damages the nasal lining. People with asthma and sinusitis are closely linked. Those with weak immune systems, people with HIV, diabetes, or autoimmune diseases are more vulnerable. People with structural nasal issues, nasal polyps or a deviated septum increase the risk. 4. Symptoms of sinusitis. Sinusitis symptoms vary depending on the severity of the infection but commonly include nasal congestion and difficulty breathing, thick, discolored nasal mucus, yellow or green, facial pain and pressure around the forehead, eyes, nose, or cheeks, headaches, especially around the eyes, cough, especially at night, postnasal drip, mucus dripping down the throat, ear pain or pressure, fever, in severe cases. If these symptoms last more than 10 days or keep coming back, you might need medical treatment. 5. Best solutions and treatments for sinusitis. The good news is that sinusitis can be treated effectively with the right approach. Here's how. Home remedies. Steam inhalation helps open nasal passages. Saline nasal spray clears mucus and moisturizes nasal passages. Stay hydrated. Drinking plenty of fluids thins mucus. Use a humidifier, prevents dryness in the air. Over-the-counter medications. Nasal decongestants, e.g., oxymetazoline, reduce swelling, but should not be used for more than 3 days. Antihistamines, help allergy-related sinusitis. Pain relievers, e.g., ibuprofen, acetaminophen, reduce headache and facial pain. Prescription treatments, antibiotics, only used for bacterial infections, not viral. Corticosteroids, nasal sprays, reduce inflammation for chronic sinusitis. Surgery, for severe cases, endoscopic sinus surgery, recommended if nasal polyps, a deviated septum, or chronic blockages are causing sinusitis. Take charge of your sinus health. Sinusitis is a frustrating condition, but you don't have to suffer. With the right knowledge and treatment, you can breathe freely and feel better. If your symptoms persist, consult a doctor to find the best solution for you. Stay healthy and take care of your sinuses.